Yeah,
May I come in?
of course.
Wonderful, thank you. My name is Jessica. I'm going to be your nurse today. How are you doing today, Jonathan?
Good, nice to meet you.
Good, nice to meet you too. Okay, so I'm going to be here to do your health history examination today. I'm just going to ask you some general questions just about your present medical status, your past medical history, including your family medical history as well. But first, to start off with, I actually already had your biographic information on hand here that you filled out prior to coming in. I have your name, date of birth, your address, but just to confirm, you are 41 years old and you do live in Tampa, Florida. Is that right?
Yes, it is.
Thank you for confirming that. And what is your primary language?
English.
Okay. Are you married, divorced?
Married.
Married, okay. Do you have any children?
No.
No? Okay. And are you currently attending school?
No, I'm not.
Okay. So your primary reason for this visit today is for a wellness exam, is that right?
Yep, just a checkup.
Okay. Is there any other reasons that you're seeking care today?
No.
Okay, thank you. So your present health and past medical history, I want to know, currently, do you have any complaints of any illness, any sort of symptoms?
No.
Okay. Okay, do you have any recent exposures to any sick contacts?
Not that I know of.
Okay, very good. And now I'm going to ask more specific questions about your past medical history, including your surgical history.
All right.
So your general health now, how would you describe your general state of health?
It's generally good.
Okay, very good. Do you have a history of any childhood illnesses?
No.
Okay. What about major adult illnesses, so current illnesses that you may have?
Nothing.
Okay. Now I want to ask about your immunizations. Are you up to date in all of your required immunizations?
Yeah, I got them all.
Okay. Have you had a flu shot or COVID vaccination?
Yeah, I got them last month.
Okay, so you got them last, sorry, I didn't hear that.
Last month, yeah.
Okay, you got them last month? Okay. So now what about travel? Do you have any recent travel experiences?
No.
Okay, so no recent traveling. Now what about any past surgical history? Any
No.
surgeries? Okay. Any serious injuries in your past?
No.
Okay, thank you. Now I want to ask more about your medications that you have, that you're currently taking. I want to ask about your current medications. What are you currently taking at home?
Nothing. I take a men's multivitamin. That's pretty much it.
Okay, so just the men's multivitamin. Okay, now what about past medication history? What have you been prescribed in your past?
Just antibiotics.
Okay. Do you remember what type of antibiotics you were prescribed?
I don't.
Okay. And what was that antibiotic prescribed for?
I had a respiratory infection.
Okay, when was the respiratory infection?
That was like 5 years ago.
Okay. Now I'm going to ask about your allergies. Do you have any known allergies to anything?
No.
No allergies? That's wonderful. So also, what about transfusion history? Do you have a history of having any transfusions?
No, I do.
Okay, now what about screenings?
Get them yearly, just checkups.
Okay, so you get your screenings done yearly?
Yes.
Okay, thank you. And now I want to ask you about your emotional state. So how would you describe your emotional state right now?
I'm feeling good, so happy.
Okay, happy and feeling good. That's really good. Okay. So obviously I don't have to ask you about any sort of menstrual history. So we'll skip that portion of the exam. I want to ask about your personal and social history here. So let's focus a little bit more in on your habits. So can you tell me more about your current diet and exercise regimen?
Yeah, I eat a well-balanced diet. You know, meats, veggies, fruits, and exercise 3 times a week at least.
Okay, very good. Do you drink alcohol or use any sort of tobacco products?
No, I don't use anything.
Okay. Have you ever used anything like that in the past?
Nope, not at all.
Okay, very good. Do you have a history of illicit drug use?
I do not.
Okay. Now I want to ask you about your self-care habits. So can you describe to me what you do for your self-care?
I like to take my wife on walks and work out, just, that's about it.
Okay, very good. Okay, and now I want to ask a little bit more about your sexual history. Do you just have one partner?
Of course, my wife.
Okay, and how long have you been sexually active with her?
Oh, for 13 years.
13 years. Okay, thank you for sharing that. Now I want to ask you about your home conditions, your housing. Do you rent, own a home?
I rent.
Okay, and at your home, do you have any pets or stairs that you have to navigate?
2 dogs, and we do have a 2-story home.
Okay, wonderful. That's nice. Okay, I'm just flipping over to the next page here. Okay, now I'd like to know about your occupation status. So, are you currently employed?
I'm retired Army.
Wonderful. So, no other occupation other than being retired
Just
Army?
retired, yeah.
That's wonderful. So now I want to know about your environment and travel exposure. So have you had any, I know you mentioned that earlier, but I just want to kind of ask a little bit more about that.
No, don't travel.
Okay. Now I want to talk to you about your family history. So do you have any awareness or knowledge of any family history of illness on either side of your family?
Yeah, my mother has fibromyalgia.
Okay, so your mother has fibromyalgia. Any other known family history?
No.
Okay. So now I want to talk to you about we're going to talk a little bit more about general symptoms, and we're just going to go kind of like a head to toe kind of questions here. So what about any general symptoms? Again, I'm just kind of getting a little more in depth here. Do you have any sort of health concerns or symptoms?
Nothing right now.
Okay. So what about your skin, hair, and nails? Do you have any history or current skin issues, hair issues, or issues with your nails?
Nothing.
Okay, very good. I see. Now I want to talk to you about your head and neck. Do you have any history of head or neck injuries?
No, I do not.
Okay. Now your eyes. How is your vision?
Oh, 2020, perfect.
Oh wow, a 2020 perfect vision? That's impressive. So what about any history of pain or trauma to the eyes?
Nothing.
Okay, do you take any eye drops?
I do not.
Okay. Now I want to talk to you about your ears, more specifically your hearing. How is your hearing?
Pretty good.
Okay, pretty good. Any history of tinnitus, discharge, vertigo, or infections?
Nope, nothing.
That's amazing. Okay, so now I would like to talk to you about your nose, more specifically your smell. How is your smell? Can you smell okay?
Yeah, I don't nose any issue.
You don't nose any issues? That's a great one. Okay, so no problems with smell. Any frequency of colds? Do you get colds at all?
Not very often, no.
Not very often. Okay. What about any sinus pain, pressure?
No, nothing.
Currently okay. Any postnasal drip, a history of obstruction or nosebleeds?
No.
Okay. Now I'm moving on to your throat and mouth assessment here. Do you have any history of sore throats, bleeding, swelling, abscesses, soreness, or extractions?
No issues like that.
Okay. So no hoarseness or anything like that. What about your dental care? How was that?
Go to the dentist like yearly, every 6 months.
Oh wow, that's really good. And what do you go to the dentist for? Do you
cleanings and
Okay, so you go to get your cleanings done. Okay, that's great. Okay, now I want to ask you about your lymph nodes. So do you have any sort of history or current issues with tenderness or enlargement of your lymph nodes?
No.
Okay, very good. Moving on to your chest and lungs. I want to know more about your history with any sort of chest or lung issues. I know you said you had a respiratory infection about 5 years ago. You were prescribed antibiotics. Do you have any other history, for example, shortness of breath, cough, wheezing, sputum, night sweats?
No, none of that.
Well, that's really good. When was your last chest x-ray?
Would have been 5 years ago.
Okay. Perfect. So that's when you had your respiratory infection? Okay. Very good. And did you have any, have you ever had any, or know of you having any TB exposures?
Not that I know
Okay. Now, obviously, I know you're a male, but have you had any sort of assessment in your chest areas for, as far as screenings for any lumps, any abnormalities noted ever?
of. No,
In your
nothing
past?
ever found.
Okay, very good. Now I want to talk more about your heart and blood vessels. So, for example, to be more specific, a history of heart condition, hypertension, things of that nature?
No, nothing.
Okay. Okay, so no history of palpitation, shortness of breath, edema, exercise tolerant, or any, previous tests that you've had?
No, everything's been normal.
Okay. What about your vital signs when you go in for your checkups? How are those normally?
Normal, in range.
Okay. So within normal limits, you would say?
Yeah.
Okay. Perfect. And no history of heart or any blood pressure issues?
Nope.
That's wonderful. Next, I want to ask you about your peripheral vascular conditions. Do you have a history of any sort of pain or bruising on the body?
No, nothing.
So no history of that. Now I want to ask you about blood disorders. Any past medical history of any sort of abnormal blood cell disorders, bruising, anemia? Okay, thank you. Moving on to your GI tract. So I want to know if you have any histories of, or knowledge of any history of GI conditions.
No issues.
Okay, so no issues with digestion or food tolerance?
No.
Any heartburn?
Very rarely.
Okay, rarely. Okay, nausea and vomiting?
No.
Vomiting up blood ever? Okay, what about your bowel movements? How are those?
Normal.
Okay, normal. And when you say normal, what do you mean by that? Do you easily pass your bowel movements, no constipation?
Easy and
Working good?
Yeah.
What about the color of your stool? Any sort of, other than
doo-doo brown.
brown? Okay, just making sure. Okay. Now I want to ask you about your, a little more in depth with your diet. So I want to know about your appetite. How is your appetite?
I'm fairly normal.
Normal? So you have a good appetite, you think?
Yeah.
You'd say? Okay. And I know you said you already told me you eat a balanced diet.
I do.
What are some of your likes? Like, what food do you like?
Seafood.
Okay. Any dislikes?
Not really.
Okay. Okay. Or do you have any diet restrictions?
No.
Okay. Do you take any supplements other than the one a day vitamin you told me about?
No, that's it.
Okay. Do you drink any caffeine?
No, I do not.
Okay. Now I want to ask about your endocrine system. So more specifically here, I want to know, do you have any sort of heat or cold intolerance?
I don't.
Any weight change?
I do not.
Any issues with your hair distribution?
Nope.
Any stretch marks?
Not that I know.
Okay. What about any sort of symptoms of like increased thirst, increased appetite, increased urination?
No, nothing abnormal.
Okay, so nothing wrong with that. Now I want to ask you about your urinary system. So, for example, any past history of any sort of flank pain, suprapubic pain, any sort of urgency, frequency, we talked about that. Any sort of issues at all with incontinence, any sort of urinary
Nope.
symptoms in your past?
All working great.
Okay. So how is your color of your urine?
Depends on how much I drink.
Do you have dark urine color?
It's usually pretty clear.
Very good. Any hesitancy with your urination? Okay. Any sort of edema ever noted on your face?
No.
Okay, so your urinary system seems normal as well,
Yes.
from what you're telling me. Okay. Okay, moving on to your musculoskeletal system, I want to ask you about any sort of history of pain again in your joints, joint stiffness, any sort of range of motion issues.
No, all seems pretty normal.
Okay. Any swelling, redness, heat, or any sort of deformities?
No, not a one.
Okay, very great. Now I want to ask about your neurological history. So, are there any histories of syncope, so like fainting, seizures, weakness, paralysis, any abnormal sensation, memory loss, or coordination issues?
No, none of that.
No, that's a lot. But so any sort of so no complaints of neurological issues? Okay, wonderful. I want to ask you now about your psychiatric history. So, do you have any history on that you're aware of?
Yeah, no, everything's normal from what I know.
So you have no history of mood changes, concentration, depression, anxiety, agitation, suicidal thoughts, or sleep disturbance?
No, not at all.
That's really great. Okay, just a couple more questions here for you. We're almost done. So the functional assessment I want to do is I just want to ask you about your activities of daily living. So for example, your mobility, grooming yourself, just your daily life tasks. Do you have any sort of issues with your ADLs?
No, I can do all that myself.
Okay, so you are fully independent?
Yeah.
Okay, with all ADLs. Very good. And one more question about your medication. I know we touched on that a couple times already, but I want to know, are there any over-the-counter medications that you're taking other than the vitamin or any herbal supplements?
No, that's it.
Well, that's really great. Well, it looks like I've been able to ask you all the questions I needed to finish your assessment today. Do you have any questions for me?
No, that's it. It was nice meeting you.
Oh, so nice to meet you. Thank you so much for your time today.